Good morning, class. Our lesson for today is Forensic Toxicology. So, we discuss about toxicology, its definition. It is defined as the science of detecting and identifying the presence of drugs and poisons in the body fluids, tissues, and organs. It is also a branch of science that applies the principles and knowledge of toxicology to issues and problems in the field of law. So the Greek term of toxicology comes from the word toxicon, which means poison. This lethal poison is used by ancient Greeks, and they would smear on the poisons on their arrows, as shown below in our illustration. And it will be later known as toxicology, which could be defined also as the study of poisons. So what is forensic toxicologist? So, it is classified as an expert in the field of medico-legal aspects of the harmful effects of chemicals of human and animals. The professional work of toxicologists fall in four main categories, that is, forensic, industrial, clinical, environmental toxicology. The work of forensic toxicologists is therefore considered as highly complicated, which finds a toxin and figures out what could happen to a person that ingested or contacted it. Examples of forensic toxicologist work. So, number one is to determine whether someone died from a poison or from natural causes. Number two is assess whether the drugs played a role in a criminal actions. Number three, perform scientific tests on bodily fluids and tissue samples to identify any chemicals or drugs present in the body. Number 4, document every step of the process and take care to follow the rules regarding chain of custody for physical evidence. Number 5, work on cases involving environmental contamination to determine the impact of chemical spills on nearby populations. What is a poison? So class, it is a substance, liquid or solid or gas, which when administered in a small quantities into living body or brought into contact leads to injury or destruction of life by its actions. Remember that anything can be a poison, which means anything when taken in sufficient quantities cause harmful or deadly reaction. What does sufficient quantities means? So, intoxicant, it requires that you ingest a rather large amount to be lethal. Example is a prescription medicine. When ingested or taken in a therapeutic dose, it may lead to treatment. However, if they have taken it accidentally, it could lead to lethal dosage which harms the body. So a poison, on the other hand, only requires a small amount for it to become lethal and harmful. So remember this note by a physician named Paracelsus 1493-1541. He noted that all substances are poisons, there is none which is not poison. The right dose differentiates a poison from a remedy. So remember it, class. So let's go to the brief history of forensic medicine in the Philippines. 1858, first medical textbook printed by a Spanish physician named Dr. Rafael Guinard Guaymas, at the time was the chief army physician Manuel de Medicina Domestica. That was the medical first textbook. So 1871, teaching of forensic medicine was included as an academic subject in the School of Medicine in the Pontificia Universidad de Santo Tomas, known today as University of Santo Tomas or UST. March 31, 1876. On this time, a royal decree number 188 of the King of Spain was made for the creation of position of medico titularis. This position was made for public sanitation and medico-legal administration of justice. December 15, 1884. On this time, the creation of a committee which studied the mineral waters of Luzon under the supervision of General Joaquin Jubilar and Anacleto del Rosario as the chemist. September 13, 1887, on this time, the Laboratorio Municipal de Manila was created, and its function is to analyze the following, which are the food, water, public health, and legal medicine and specimens for clinical purposes. 1895, Medico-Legal Laboratory was established in the city of Manila. Due to the need of medical service and assistance, this laboratory was extended in some of the provinces of the Philippines. 1898. During this time, the American civil government preserved the Spanish forensic medicine system. Upon the entry of the American regime, they did not change the system in order to preserve and make use of the system by the medical expert at that time. 1899. The first crime laboratory was established by the U.S. Army under the supervision of Lieutenant R.P. Strong within the period of 2 years. Another year is 1901. The Philippine Commission was created. The Provincial, Insular, and Municipal Board of Health, as provided by the Act number 157, 307, and 308. The Philippine legislature maintained the pre-existing medico-legal system in full force in the administration of Administrative Code. July 1, 1901, Bureau of Government Laboratories or BGL was created, and its function was to perform biological and chemical analysis and reproductions of vaccines and sera. Sera is known as a serum or blood serum, the fluid portion of the blood obtained after the removal of the fibrin clot and the blood cells, distinguished from the plasma in circulating blood, sometimes used as a synonym for anti-serum or anti-toxin. The clear yellowish fluid obtained upon separating the whole blood into its solid and liquid components after it has been allowed to clot, also called as a sera or serum or blood serum. By virtue of the Act 156 by Civil Commission, and Dr. Paul C. Frere was the first director on June 21 but assumed position on September 21. In 1919, the University of the Philippines was created the Department of Legal Medicine and Ethics with Dr. Sixto de los Angeles as their chief. On January 10, 1922, the head of the Department of Legal Medicine and Ethics became the chief of the Medico-Legal Department of the Philippine General. So on March 10, 1922, the Philippine Legislature enacted Act number 1043, which became incorporated in the Administrative Code as Section 2465. This was amended by Commonwealth Act 537 and further amended by Republic Act 272. The Act of 1043 that is incorporated in the Administrative Code as Section 2465 provided that the Department of Legal Medicine, University of the Philippines, become branch of the Department of Justice. On December 10, 1937, the creation of Commonwealth Act number 181 and further creation of Republic Act 157, the Act creating the Bureau of Investigation, and was amended by Executive Order number 94 to change the name of Bureau of Investigation to National Bureau of Investigation. The Act number 181 was passed to create a division of investigation under the Department of Justice. The medico-legal section was made as an integral part of the division. So March 3, 1939, the Department of Legal Medicine of the College of Medicine, University of the Philippines was abolished and its functions were transferred to medico-legal section to the Division of Investigation under the Department of Justice. This will be our end of our topic for today, and our continue discussion of the brief history of forensic medicine in the Philippines and abroad be further discussed by next week. Thank you, class, and good day.